Hi everyone, hope you're all doing good. In this video, we are going to talk about the various stages of labor. So, stages of labor. Labor is divided into 4 stages. Okay. So, the first stage is from the onset of uterine contractions till full cervical dilatation. Onset of uterine contractions till full cervical dilatation. So, this will be around 10 centimeters. Okay. And the second stage is from the full cervical dilatation to the delivery of the fetus. Till the delivery of the fetus. Okay. And the third stage is from the delivery of the fetus till the delivery of the placenta. And in the fourth stage, this is an important stage, okay, where there will be arrest of bleeding. Okay. Now, we'll see how the labor onset occurs. Okay. So, onset of labor. There are so many hormonal changes that is taking place, okay, which includes number 1, there is increased estrogens, okay, that will upregulate the myometrial gap junctions. Okay, and also the receptors. So, oxytocin receptors increase in the myometrium up to 100 to 200 folds. And not only this, the sensitivity of the oxytocin receptors also increase. Still, the role of progesterone is not clear. But we see the prostaglandin synthesis also increasing near the term. Prostaglandin synthesis increases at term. Okay. Now we'll see about pre-labor or the preparatory phase of labor. Pre-labor or preparatory phase of labor. Okay. First point is lightening will occur 2 to 3 weeks before term. And you all know at 40 weeks, what happens? The uterus is going to descend. Okay, so the engagement is going to occur. As the engagement is going to occur, the fetus is going to descend downwards into the pelvis. So when it is happening, the uterus size comes back again to 32 weeks of gestation. But remember, at 40 weeks, the flanks are going to be full, but at 32 weeks, the flanks will not be full, right? Flanks full, and here the flanks are not full. Okay, but as the descent is happening, what is going to happen? There is a compression of the gravity uterus over the lungs, diaphragm, etc., and the patient will be having so much difficulty in breathing. Now, as the uterus is going to descend down, she will get relief from this compression and she is going to feel more comfortable in breathing. Okay, so that is known as lightening. So, lightening is basically as the engagement occurs, engagement of fetal head. Okay, as the engagement of fetal head occurs, the compression over the diaphragm and lungs are relieved, and the patient breathes with ease. Okay, so that is known as lightening. And the next thing what happens is engagement. Okay, and this engagement happens during labor in multigravida, but in primigravida it happens 2 to 3 weeks before. Okay, 2 to 3 weeks before delivery itself. Whereas in multigravida, this happens during labor. Okay, what is basically engagement? The largest head of the fetal skull is passing through the largest diameter of the maternal pelvis. For now, you understand this. Okay, so the largest diameter of the fetal skull is getting fit into, okay, the largest diameter of the maternal pelvis. Okay, at this stage, vaginal secretions will increase. Okay, and there is change in cervix also. The cervix is going for dilatation and effacement, and it is becoming more soft. So it goes dilatation, effacement, and it becomes more soft. Okay, first we will see about dilatation. The important cause of dilatation is uterine contraction. Okay, and when uterine contraction is happening, what is going to happen? We have the membranes with the amniotic fluid surrounding the fetus. So that is also going to descend and it will be coming into the cervix. Okay, so basically the pressure that is provided by the amniotic fluid is also going to dilate the cervix. Can you understand? So it is also the membranes with amniotic fluid pressure that is dilating the cervix. Yes, and another factor for dilatation is the fetus itself. Okay, so the fetal presenting part is also going to give some pressure on the cervix, and it will also be helping in dilatation of the cervix. Okay, so the fetal presenting part. Okay, so if we see a diagram, okay, imagine this is the uterus. Okay, this is the uterus, and we have the membranes with the fluid, okay, and imagine there is a fetus, okay, say the fetal head alone I have drawn, okay. So, this is the cervix actually, okay, this is the cervix. Now, what is going to happen? First point, there is a pressure, okay, from everywhere due to the uterine contraction, okay, and this pressure is going to push down this membrane down, as well as the fetus is also going to come down, okay. So, as this membrane with the amniotic fluid is giving a pressure along with the fetal head part, what is going to happen? This cervix is definitely going to dilate, okay. So, this is how dilatation happens. Now, we will see about effacement. Okay, effacement literally means taking up of the uterine cervix into the lower uterine segment. Okay, so taking up of the cervix into the lower uterine segment. So, what does this mean? Number 1, there is shortening of cervix. Yes. And number 2, there is lengthening of the lower uterine segment. Yes, correct. Lengthening of lower uterine segment. Okay, so this is known as effacement. So, if you see the lower uterine segment length, okay, in a non-pregnant woman is only around 0.5 centimeters. Suppose if she becomes pregnant, at term, this will be around only 5 centimeters. Okay, and during labor, what happens is this becomes around 10 centimeters. And these two components, that is the effacement and dilatation of the cervix, are the components of the modified Bishop score, and they are expressed in centimeters. Can you understand? Yes. So, they are components of modified Bishop score and expressed in centimeters. Clear? Now, the cervix becomes soft. Why? Because there is an alteration in collagen structure, glycosaminoglycans, and matrix metalloproteases. Okay, so that will be making the soft consistency of the cervix. Okay, and we have something called as bloody show also during labor. So, what is this bloody show? We all know there is a cervical mucus plug during pregnancy. Okay, it is present all throughout the pregnancy. So, this plug will be coming out. Okay, and that will result in a sticky jelly like pink colored mucus coming out, and sometimes this may also be accompanied by small amount of blood. Okay, so this will happen sometimes. Okay, so this is known as bloody show. Now we will see about the first stage of labor. Functionally, this first stage of labor is divided into 3 divisions. Number 1 is a preparatory division. Here, there is only little dilatation of the cervix. Okay, and this can also be considered as latent phase of the first stage. Okay, and then comes the dilatational division. Here, the dilatation is to the maximum, and this can be considered as active phase of first stage. And third division is the pelvic division where the cardinal movements of labor occur. Clear? Now here we are going to discuss about the first two divisions only. Cardinal movements of labor will be discussed in another separate video, right? This starts with the onset of true labor pains and ends up to cervical dilatation of 4, 5 and 6 centimeters. Now you can ask me, ma'am, why this 4, 5 and 6 centimeters? Because there are various definitions given by various people. Okay, so this 4 was given by Friedman when describing portograph, and 5 criteria was set by WHO, and now ACOG has set a criteria of 6 centimeters. So we can keep cervical dilatation of 4 to 6 centimeters basically. Okay. So let us also see about the duration in a nullipara and multipara for this completing this latent stage. In a nullipara, the maximum duration is around 20 hours, and in a multipara, the maximum duration is around 14 hours for completing this latent stage. Okay. So at this point, I want you to make clear about the true labor pains and the false labor pains also. Okay. True labor pains and false labor pains. At this point, I want you to make clear about the difference between true labor pains and false labor pains also. Okay. In true labor pains, contractions are going to occur at regular intervals. Contractions at regular intervals, whereas in false labor pains, they are going to occur at irregular intervals. Okay. And with true labor pains, remember that the frequency of contractions is going to increase over time, and at the time interval between the subsequent contractions are going to reduce with time. Can you understand? So here the frequency is going to increase and duration between next contraction or subsequent contraction usually reduces. Here there is nothing like that. Okay, frequency does not increase with time. Okay, and also the duration does not reduce with time. Okay, and with true labor, whatever we have discussed before, like cervical dilatation, engagement of fetal head, and the bloody show, right? All these are going to happen. All these are seen. Whereas in false labor pains, definitely none of these are seen. Okay? Yes? Clear? So, this is the difference between true labor pains and false labor pains, and you will be counting the onset of latent phase only when there is starting up of the true labor pains. Clear? Yes. Now, this is the difference between true labor pains and false labor pains, and you will be counting the duration of latent phase only when the true labor pain commences, right? Now, we will see about the active phase of first stage. Active phase begins at 5 to 6 centimeter of dilatation and ends with full dilatation of cervix, that is 10 centimeter dilatation of cervix. Okay, and usually in the latent phase, okay, that is up to 4 to 6 centimeter, the rate of dilatation is going to be slow. Okay, rate of dilatation if you take is slow. But in active phase, okay, say after 6 centimeters, definitely the rate of dilatation is going to be fast. Okay. According to Friedman is the person who invented photograph. Okay. The rate of dilatation in primiparas. Okay, in primiparas, the rate of dilatation is 1.2 centimeter per hour. Okay. The same way, in multiparas, this is around 1.5 centimeter per hour. Okay, in the active phase. So, from this, we can take at least there should be a dilatation of 1 centimeter per hour, whether it is a primi or a multi. Sure. Now, there was a study done by Zhang and his associates in 2010. Okay, he says that, okay, there is a more gradual increase in the rate of cervical dilatation. Okay, that means in active phase, okay, that is more than 6 centimeters, it can be less than 1 centimeter per hour also. Okay. For example, rate of dilatation at 8 to 9 centimeter can be more than the rate of dilatation that has happened at 7 to 8 centimeter. Okay, and the rate would accelerate progressively. Can you understand the point? So, after 6 centimeters, we can't fix a particular duration, like there will be dilatation of 1 centimeter per hour. Okay, it varies and it gradually the dilatation is going to happen. Okay, for example, at 8 to 9 centimeter, there can be a dilatation of only 0.5 centimeter per hour. But when it comes to 9 to 10 centimeters, the dilatation can progressively increase up to 1 centimeter per hour. Okay, so this was concluded by Zhang and his associates. So if we take the duration, okay, in nullipara, the median duration is 4 hours and maximum it can go up to 12 hours. Okay, and similarly, in multipara, the median duration is 3 hours and maximum duration can be about 10 hours also. Clear? Now, during this phase, what happens? There is formation of lower uterine segment. There is descent of the presenting part. There is formation of bag of membranes. And there can also be rupture of membranes. Okay. So, this is all about the first stage of labor. Do you remember what is second stage of labor? It is from full cervical dilatation to the delivery of the fetus. Yes, very good. Now, the duration is highly varying in the second stage. Okay. If you take in a nullipara, the duration can be around 50 minutes, and in a multipara, this can take only 20 minutes. Okay, and during this second stage, descent of fetus will be continuing. Yes. Then there can be crowning of fetus followed by the delivery of fetus. Yes. Okay. And also the mother will get the urge to push. Okay. Urge to push, that is also known as bearing down effects. Okay. This stage can vary with epidural analgesia. Okay. Suppose if you give epidural analgesia, a small increase, okay, but it is not that much significant. So, there is an insignificant increase in the duration of the second stage of labor due to epidural analgesia. Next, we will see about the third stage of labor. See, duration can vary anywhere between 5 to 30 minutes. What is third stage of labor? It is from the delivery of the fetus to the delivery of the placenta. So, for the delivery of the placenta, you can wait up to 30 minutes. Okay. And this is again divided into 4 phases. First one is the latent phase, where the placental free wall of the uterus will contract. Okay. And next one is the contraction phase. Now, the uterine wall of placental attachment contracts. Third phase is the detachment phase. Means the placenta is going to separate from the uterine wall. And fourth phase is the expulsion phase. So, placenta is expelled out of the uterine cavity. Can you understand? Yes. Now, we all know there are 2 methods of placental separation, that is Duncan's method and Schulze method. Okay. We will just revise this in this stage. Okay. So, in Duncan's, there will be marginal separation of placenta, and in Schulze, remember the C. So, it is central separation of placenta. Now, as the marginal separation is happening, which surface of the placenta presents in Duncan's? Yes, it is the maternal surface. So, maternal surface of placenta presents. Whereas here, just the opposite, right? So, fetal surface of placenta presents. Okay. And in Duncan's, the bleeding will be more. Okay. Bleeding is more. Whereas in Schulze, the bleeding is comparatively less. Okay. And the more common method is Duncan method. In Schulze method is a less common method. Clear? Okay. Now, we will see the 2 methods. Okay. So, which is the Duncan method and which is the Schulze method? See here. Okay. So, this is the Schulze method because you have a central separation and a formation of retroplacental clot. I forgot to tell this, there is a formation of retroplacental clot in USMLE method. Okay, so it is retroplacental clot. Whereas here in a Duncan method, marginal separation is happening, okay, and it is the maternal surface of the placenta which is going to present first, and there is a increased amount of bleeding also. Clear? Yes. Now we will see the fourth stage of labor. What is going to happen is the uterine myometrium is going to contract and retract because this is a stage in which the arrest of bleeding should happen. Okay. Already we know that in the myometrium there are crisscross like muscle fibers. Okay. So like this it will be. Okay. So crisscross like muscle fibers, and in the centers there will be blood vessels. What will be happening is this crisscross layer of myometrium is going to compress the blood vessels, and that will be reducing the bleeding. Okay, and finally the bleeding will stop also. Okay, hence this middle layer of myometrium is also called as what? Yes, living ligatures, and this will extend over 1 to 2 hours. Okay, when it is perfectly done, there will not be any postpartum hemorrhage. Okay. So, with this we are completing the various stages of labor. I hope you would have understood what is first stage, what is second stage, what is third stage, and what is fourth stage, and what are the latent and active phases also. Okay. So, this will form the basics for all the rest of the labor topics we are going to do. So, until we meet in the next video, happy learning, take care and bye-bye.